our mission is clear. We want to have our task force ready, building on the incredible work of the people over this last weeks and months here that we got a chance to listen to and talk with and question and discuss things with yesterday and today, building on their incredible work to be ready for 31 December. If things arrive on 1 January, which obviously the Minister of Health and the Premier and the members of the government, and I'm sure the people of Ontario would love, we're going to be ready to ensure that we receive it, that we distribute it, that we handle it appropriately, that the medical professionals who are going to ensure that the vaccinations occur are ready and equipped, and that the public is aware of what's going on and ready for what their role is to play to get vaccinated and get protected, and that we can track it then from stem to stern, so to speak, as we're doing that. Our mandate is clear. The team that we're bringing together now, the Secretariat, it's an integrated team. There are a couple of people that have come with me, former military planners who have worked on operations around the world and in Canada, and we have been combining these last days with the people from the Ministry of Health and Solicitor General, building on the good work that all of them have been doing, and it is good work, I'm going to say that again. And our role is really to tie the strings of those 4 lines of operation together and make it one very coherent operation. So it's not just distribution and logistics, and it's not just a medical piece to vaccinate folks, and it's not just an education to the population of Ontario, and it's not just tracking. It's all of those things that we need to tie together in a coherent operational plan and then execute it so we have an efficient operation that gets the vaccines out to the people of Ontario and get them vaccinated as soon as those vaccines show up for us. That's what we're doing now. We got a couple of milestones set for ourselves to reach next week. The week following that, we want to do some exercising to stress what our plan is and how our team is. And you know, when you say 31 December, you kind of want to be ready by Christmas Eve, because Christmas to New Year's is always a bit more challenging, no matter how dedicated you are in getting ready. But we are going to be ready for 31 December. You know, it is an unknown when the vaccines arrive. Both the Premier and the Minister talked about that. In the military, we've operated all of our lives with the unknown. And so what we do is plan for worst case, plan for kind of everything arriving on the 1st of January. If you can handle that, you can handle anything going forward from there. And so that's what our work entails right now, and that's where we're going. The team is being built. It's largely present and in place, and they're building on the work that's been done. And I'm not an over-the-top optimist. I'm a pragmatic person, but we're going to be ready on 31 December for what the people of Ontario will need from us. You know, I don't really want to speculate about the actual details of the vaccination, but here's what I would say. We're looking at everything, and we're doing that with the professionals that do this. This is not their first rodeo. They've done flu vaccines, they do shingles vaccines, they do pneumonia vaccines on a routine basis in huge numbers, so there's a lot of good history to build on. I had the opportunity to speak last night with Chief Matt Pegg from obviously from the City of Toronto, the Fire Chief and COVID-19 Task Force Leader, and to walk through what he's thinking, what he's planning, what work they've done. We obviously are going to be working very closely with the municipalities because, you know, this is a job that spans every single person in the province, and we want to be able to reach out in the most efficient manner possible. So we're looking at all options for vaccinations, vaccination sites, and how we'll do it, and tie all that together in the coming days here. So, like I said, so we're ready on 31 December. I know we're all anxious for the vaccines to arrive. We're all tired of the pandemic and the kind of lives we're forced to live. But just think, 4 or 5 weeks ago, it was if we get a vaccine. And now here we've crossed the nexus here. We've changed how we're looking at things. We have vaccines on the way. Yes, we want them all tomorrow, but what a change in tempo that's been. And the last thing I'll say, and I'll get away from here, is, you know, I had the chance to interact over these last days here with some of the most incredible, professional, intelligent, dedicated, committed Canadians that you could ever meet in the Ministry of Health and the Solicitor General, other parts of the Government of Ontario, the police forces, City of Toronto, and responders, and oh my goodness, those folks are incredible, and the people of Ontario don't get to see as much, don't get to hear as much of just how incredible they are, how hard they're working, how dedicated they are, how professional they are, and how they want to make this vaccination rollout, the war against COVID-19, how much they want to make that a victory, and also how tired they are. And we've got to re-energize them, we've got to resupply them, we've got to make sure that they're focused and they've got all the support that they need to finish the last part of the battle in this pandemic. Obviously, that's what I'm committed to trying and do in my part of it. But again, I just want to say to those folks, thank you. I'm proud to be Canadian, every time I'm around you, and every time I see what incredible commitment, professionalism, and dedication that you have.